And now, here's your host, Laurie White.
Hey, welcome into the Consumer Advocate Show for this Wednesday, January 26th. I fooled myself. I was still on Tuesday, and when I was typing in to say welcome on our chat room, I thought Tuesday. Oh, no, wait a minute, it's Wednesday. Wake
up, Laurie. The
where
world
is this
needs
week
you.
gone already? They say when you get older, it goes faster.
It does.
Tomorrow will be Friday. Anyway, we're happy to have you with us on the Consumer Advocate Show, and we've got a great discussion ahead with the folks from the El Paso County Public Health, or from El Paso County Public Health. I have to really work hard to not call you the old name, and we'll talk about the new name for what we used to call the El Paso County Health Department coming up in just a minute. You can join in the conversation, and of course our numbers are 593-7241 or 593-7242, and our chat room, live chat, so if you're at your computer and want to ask a question, just type it in, and we'll get it right to our visitors today. ConsumerAdvocateshow.com is our website. All you have to do is click on the pencil, put in a username, and join in the chat. We welcome you to do that. We also are welcoming in, and, you know, it's funny, after all the years in the business, you talk to so many people on the phone, and you just never have the opportunity to meet. So Susan Whelan is here, and Susan and I have had so many different phone conversations. Susan, nice to have you here and meet you in person.
It's nice to be here. Thank you, Laurie.
And the Deputy Director, Dan Martindale, also joining us. We also found out no relation to Wink whatsoever.
None whatsoever. And good morning, Laurie, and we thank you for this opportunity to be on your show.
Thank you very much. And Susan, of course, the Public Health Information Officer. We've got a number of things to discuss, and right off the top, we mentioned the name change. Tell us, Dan, if you will, what led to the name change and how that represents the new health department, if that's the case.
And the name change is something we've been discussing for several months now, and we just thought it was a good time to simplify our name and really focus on what our mission is. From time to time, people get a little confused with our old name, El Paso County Department of Health and Environment. So we took the environment out, even though it is still a component of our agency. So as you mentioned initially, we are El Paso County Public Health. Our focus and our mission are to protect health and wellness of our community, and we utilize different collaborations within our community to do those sorts of things. So prevention, partnerships, and through collaborations, we work hard to do our public health in our community.
And always updating and innovating and
definitely. One of the other timing things was the fact that we anticipate hopefully moving to a different location here too in the later on in this year. So we thought, hey, why not take a look at our name, and we went ahead and decided to change it.
Awesome. For those of the folks that are not really familiar with El Paso County Public Health and all the things you do, and I didn't even realize there were 4 separate divisions. Can you talk a little bit about how, the different areas that you guys work in?
Definitely. I'd like to first say, in regard to our budgeting, many people, again, I think have the perception that we are 100% tax funded via the county. We are not. We have a 2011 budget of about $14,800,000. Of that, only about 20% comes from the county. 57% of our budget and the bulk of our budget comes through contracts, grants, whether it be federal funding, pass-through funds through the state health department, fees and those sorts of things for some of the services that we do offer at the health department. So from that budget, we do have 4 different divisions. We have our disease prevention and control, health promotion, our health services division, and environmental health. Obviously, there's several sub programs within those 4 divisions. But we do the best we can with the money that we have. We feel that we are very effective and efficient in what it is we do on a day-to-day basis.
Very much so. And, of course, my partner, Michael Satterfield, is here as well, joining in the conversation.
Well, I'm trying to figure out what to ask next.
Well, I want to go back to the money for just a minute. Was there a point where it was all county funded and you found that you had to, because of maybe budget constraints, money from the county, that maybe you had to expand where the money came from? Or
well, to give you an example, since 2000, county funds that we used to receive have been cut by about 41%. So we've had to really take the initiative to look in not so typical ways how to find other grants and funding sources. All while we're trying to really focus on our core public health services here for El Paso County, and hopefully expanding and assessing the need of the community so that we can also focus on additional programs as we are able to find that funding.
You sound like any other business, creative funding.
No, we are not unique.
Yeah.
Well, 41% sounds rather extreme, especially since, you are the health department. I mean.
Well, and we're not, like I say, we're not unique. Other county departments as well, due to our economy and so forth, lower tax income for the county has forced all of us to take a harder look at where our funding sources are and really build new and additional relationships with other folks in the community statewide and even at a national level to find different funding sources for those core public health services that we're trying to offer to El Paso County citizens.
Now, you mentioned the 4 divisions, and I would imagine with certain programs, many programs maybe, they might overlap a little bit because you talk about education, but then services, for example, WIC, which got me through when I was a young single mom.
Well, and WIC is one of those programs. It's federally funded. This is a good example of pass-through funds. The Colorado Department of Health and Environment actually received those funds from the federal government. We apply for those funds, and then thankfully we're able to get just over $2 million to support the services that we offer to our WIC clients. We currently have about 15,000 WIC clients here in El Paso County. And for those folks that are listening that don't know what WIC stands for, it's Women, Infants, and Children. It's for pregnant women and their children who are 5 years of age and under. It's a nutrition program, an education program. It supports via vouchers healthy food to supplement what the clients are already buying on a daily basis. So we also offer referrals because you can imagine, and maybe through your experience, Laurie, too, there's other areas that we need to assist these clients with. So if there's need for other services within the health department or within the community, we can refer those clients once they've had their WIC appointment to other resources in the community.
Generally, the funds are limited for those women.
Definitely.
With their kids, so you help out with...
Right, and there are income guidelines, requirements for folks that come to the WIC program. Right. So, yes, they are lower income families and women.
Does it cover, like, prenatal care, or...?
It doesn't cover prenatal care. However, again, within the community, there are resources. So if a client comes in, obviously they go through their WIC appointment. If they've got other needs that they're expressing to the WIC educators and other staff within our WIC program, we will refer them to the appropriate place where they can either get information or help with those other health care and public health needs.
And WIC is moving to a new location. Is that a sign of the growing need and services that you provide?
Exactly. We actually had a WIC satellite office down in the southern part of the county. It was in Fountain. This new location will take the place of that WIC office, and we're happy to say that on February 1st, we'll be opening the new office, and it's located on 97 Widefield Boulevard in Widefield. We're happy also to say that this office will be twice the size as the former office, so we'll be better able to serve those clients in the southern part of our county.
That's great. And a big open house coming up on the 31st of this month.
Exactly, and that's from 10 to noon. So if folks would like to check out the new facility, we'd be happy to have them down there, and we can talk about the WIC program, the new facility, and whatever else they want to talk about related to public health.
And a lot of folks, and I'll admit I'm guilty of it myself, assume that you just help low-income, indigent, homeless families, but your scope is far-reaching, isn't it?
It is far-reaching, and I'm glad you brought that point up. Public health is about population-based public health, and that is where we try to really reach out to the maximum amount of people within our county. You know, we do get confused sometimes with community health centers who really do focus more on the service-oriented type programs. But for a good example of population-based health, if you may recall in 2009, 2010, we were going through the H1N1 flu, and you may recall that we had several flu clinics throughout the county.
You bet.
That's really what population-based is about, going out, preventing disease, and really reaching out to the people of El Paso County on a large-style basis. Another thing that public health is really about is assessing our community, trying to find out what the needs or public health needs of our community are. And then through those assessments and program evaluations, et cetera, we can develop what our policies are going to be, our strategic plans for the future, those sorts of things. So public health really does encompass a lot more than just from time to time someone coming and getting their immunizations, for example.
I would imagine the way times have changed and everything, another addition to what public health does is maybe tie in with FEMA, Homeland Security, that kind of thing?
We do have an emergency preparedness program at the health department. Again, that's federally funded. The money comes through the state health department. But with our emergency preparedness program, they did a lot of the coordination along with other staff and nurses, public health nurses, and all staff were involved with, for example, the H1N1 clinics that we did last year. So we're very thankful that we have that, and we're always training and doing exercises to be better prepared for whatever emergency might arise here for our citizens in El Paso County.
Do you also take an educational role in that, or does that fall upon other departments? Actually,
some of the staff within our emergency preparedness department are regional trainers, so they actually go out to other counties as well as El Paso County. All staff within the health department are required to take fundamental training for emergency preparedness, so we all know what our roles are should that emergency arise, and we never obviously know what day or time that could be.
Yeah, exactly. And in the training exercises that we sometimes see at the airport and things like that, are you guys involved in that as well?
Yeah, sometimes we do tabletop exercises where we go through different scenarios and that sort of thing. Sometimes not all the staff are involved with perhaps some of those exercises like you mentioned at the airport and so forth, but it depends on what our community needs. We work within an incident command system, so we work with the county and city and state sometimes as well.
In terms of emergency preparedness, I mean, is there a separate fund that you can draw on if there is a real problem? Because to be honest with you, I got to tell you, $14 million doesn't really sound like a whole lot of money to be taking on what you're taking on here, you know?
Right. And again, we do get our funding for the training component of and the emergency preparedness program that we do have at the health department. Depending on the situation, depending on the emergency, what we generally do, we can receive federal funds. As we're going, and this is part of the incident command system, we have a finance branch, just as any business would, to keep track of staff time, to keep track of all the particular equipment or goods, services, whatever it is we may need through other vendors. We keep track of that just like any accounting office would. And then once the emergency hopefully subsides and is over, we can then go to the federal government through the state to see if we can get reimbursement for those particular expenses.
Okay. All right. Because I always worry about that thing with the gophers every year, and they got some crazy disease, you know.
Well, and speaking of that, there are diseases, there are viruses, bacterias floating all around. If you're not sick, you know somebody who is. We're going to take a break right here, but we'll talk about what exactly is going around. Is it the flu? Is it not? Is the flu still on the way? We'll ask Dan about that. And also, we'll talk about their restaurant and overall food retail inspections and what those are all about and how they're protecting us and educating us. We'll talk about those right after this quick break here on Sports Radio, 1300 AM, the Sports Animal. You're listening to the Consumer Advocate Show. Call in 593-7241 or 593-7242. And you can also join the live chat, consumeradvocateshow.com. We want to say hi to TJ, who's joining us this morning. And TJ, we will get to your question for Dan Martindale coming up in just a minute.
Sports Animal 1300.
And we're back on the Sports Animal 1300 AM. Nice music, Wheels. We're taking your calls at 593-7241 or 593-7242. And you can join in the live chat at consumeradvocateshow.com, as TJ has and does. And we're so happy to have you with us, TJ. TJ's question is, what about programs for shut-ins and elderly who are unable to shop and cook good meals? And, of course, with us, Dan Martindale, the Deputy Director of El Paso County Public Health, and Susan Whelan, the Public Health Information Officer. What about that question, Dan? It strikes me as being something that is more directed to Silver Key, but how do you get involved in that?
Yeah, and really, again, we do a lot of referrals, as I mentioned, for example, with the WIC program. This would be another instance where we would certainly get all the information we could from individuals that may have this question, and then we would do our best to locate other organizations and agencies within the community that deal with this type of issue. Another great resource is 211, and people may not know about that, but 211 offers a lot of different information about a lot of different subjects, especially for those people in need within our community. So I would certainly ask people to call that number. There'll be someone at the other end of the phone that can answer their questions and guide them to the best resource possible appropriate for their question or issue.
And, Susan, we were talking during the break. This is a great service for especially folks who are new to the area, who have questions, and not only health-related questions, but broad questions about, various aspects of their life.
Mm-hmm. And this has been a very helpful organization. As Dan had mentioned earlier, that we do a lot of collaboration with many, many agencies in the community. And 211 has been fabulous. When we were going through the H1N1 pandemic, we use them as a resource for the public to call and find flu shots in the community in their location. El Paso County it's a big county, and you want to make services convenient and also provide the necessary information as far as cost and all of the details. And 211 is fabulous in helping to resource people to meet their needs in the community and in the most convenient way.
We've got a call, and I believe it was Dennis. I knew it started with a D. Dennis, thanks for calling in. You had a question about water.
Yes, I've been a resident of Colorado Springs for quite some time, and, on TV I hear these info commercials all the time on you need to filter your water, it's not safe in some places. Of course, those are general ones, and I was just wondering, in Colorado Springs, is our water being tested frequently? Is it okay to drink? Is it fluoride? Do you have any arsenic or any of these chemicals that the manufacturers put in the water? Is that being taken out?
Is that a county or a city-related issue?
Well, I'm drinking at a city, I guess.
Yeah.
That question would probably be more appropriate answered by the city of Colorado Springs. The El Paso County Public Health Department, we do some well water testing. That's a great question that you have, but that's more of a question, I believe, for the Colorado Springs city utilities that actually is, has their hand in, with the water and would be able to address your question better.
Okay. May I have a follow-up question?
Sure. Go ahead, Dennis.
Somewhat related. Well, with all of the growth of the population out in El Paso County, out to the east, particularly Falcon Way, are our aquifers drying up? These people that are buying property out there going to have, do you think, sufficient water, provided we don't have a drought?
And that's a good question, Dennis. And I'm not prepared to answer that question. So probably what would be helpful, because I do want to get you, an answer to your question, is if you could provide your contact information, and then I can get back with you and provide you an expert to address your question.
Well, thank you.
We're looking for somebody with a crystal ball for that one, Dennis, I think.
Yes, I am.
If you'll hold on the phone, we'll get your information. Wheels will get your information, and Susan will get you in touch with the right person, okay?
Well, thank you very much.
Dennis, thanks for listening, and we really appreciate your being a part of our show. Thanks. Hold on. Those are tough, and people have more specific questions, but that's the thing with you guys with El Paso County Public Health is if you don't have the answer, and I know from experience, Susan, you go out of your way to find the person who will have the answer.
Mm-hmm. Absolutely.
Let's. One of the other things we were going to talk about was the inspection reports for retail food establishments. That's fairly new, or have you always been doing that?
Yeah, we kicked that off December 15th of 2010, and we've had a tremendous response from the public as far as accessing inspection reports online. And again, I mean, it's about convenience. We want to provide folks with information in the most convenient way, and we have the ability to do that now online. And the website that you can access those inspection reports is www.elpasocountyhealth.org. And so we have lots of information up there. And so we would encourage you to go look at retail food establishment inspections. It doesn't only include restaurants; it includes grocery stores and convenience stores and those types of things.
Now, I know state law requires that the unannounced food safety inspections. Haven't they always? And if they have, who was doing it prior to?
Well, they have, and I've been with the health department 16 years, and I know that we've been doing it that long and a lot longer. I think it's important to remember that our inspectors from the health department actually are there to help restaurants and those involved in food and food service, the food service industry, to educate them because obviously managers, owners, workers at these establishments want to protect the safety and health of their patrons. And, we always like repeat business. So that's one thing to keep in mind. We work with these folks so that they know exactly what's expected in terms of food safety. Things, for example, that they look at are things like hand washing, very simple but needed things in the restaurant business. Mm-hmm. Are there sick employees working there handling food? Is the water and sewer systems operating properly? So most things that most individuals would think, boy, that's just common sense. But, there's new workers come in quite often in these restaurants, and they need to be educated about how to keep the public and their patrons safe.
And that's the primary goal, is to educate everybody.
Exactly.
Obviously, if there are violations, you have to deal with that.
Right. And I wanted to mention Susan gave the web address for the online inspection reports, and I visited that this morning. If it's simple for me, it'll be simple for anybody. And it does list very simply. All you have to do is plug in the name of the restaurant that you're interested in checking out, the city, and click search, and that's all you have to do.
So the inspectors aren't walking in twirling their evil mustache saying, "I'm going to bring you down."
No, they're going in saying, "How can we help?"
Excellent.
Well, there is one major health warning out there that we should talk about. My wife says that we should warn everybody not to eat my cooking. So.
Inspectors, in fact, are banging on your door right now.
But they won't eat it. So.
And we do have just a little bit more time, but we wanted to address. And can you give that website one more time for folks who maybe weren't ready for it for the food inspections?
www.elpasocountyhealth.org.
Okay. And there will be an obvious button that you will push and go right to the listings.
Exactly.
Correct. It's right on the front page. So www.elpasocountyhealth.org.
I'll tell you what, we're coming up on a break time, and if you guys don't mind hanging around just a few more minutes,
sure.
We want to talk about all the crud that's going around, making people miserable. Is it the flu or isn't it? We'll talk about the answers coming up, And again, that may require a crystal ball. We're not sure. Join in the conversation at consumeradvocateshow.com. Our live chat going. And TJ, thanks for the question. Also, our phone numbers 593-7241 or 593-7242. We'll be right back.
Hi, it's Glenn Beck.
Welcome to the Consumer Advocate on 1300 AM, the sports animal, the unbiased, impartial radio program that puts the consumer first. Call in with your problems, questions, recommendations, and complaints. We're here to find the answers, address your concerns, and talk about current consumer issues. And now, here's your host, Laurie White.
Hey, thanks for hanging with us on a Wednesday morning. Hope it's a good one for you. Our call-in number is 593-7241 or 593-7242. The live chat always open at consumeradvocateshow.com. And TJ, one of our regulars, and I promised I would read everything on the chat board, so I'm going to read what TJ wrote. He says, I've really enjoyed listening to your show online and joining in the chat room. It's very interactive. Thank you, TJ. We really appreciate that.
Well, wait till you hear about this next subject. We're going to talk about the creeping crud.
Again, joining us this morning, Deputy Director of El Paso County Public Health, the new name. Yep. I'm working hard to get that right. Dan Martindale's with us, and Susan Whelan, the Public Health Information Officer with El Paso County Public Health. Nice to have you both with us.
Nice to be with you.
It's been very informative, and Susan wants this disclaimer right up front. They are neither doctors nor nurses.
Although we do have doctors and nurses and epidemiologists, but Dan and I are not credentialed.
Amazing doctors and nurses at the health. Public health, it's really wonderful. So many people, like I said, if you're not sick, you know somebody who is, and there's this weird thing going around that's upper respiratory, your voice goes out. My daughter, I always taught her to share, and after she had it for a few weeks, she did share with me. What's the word from the officials? Is this flu, or is it a strange virus, or?
Well, I think what I'd like to do is just kind of go over the symptoms very briefly. Okay. I know we're running out of time here. People do get confused and ask, do I have the cold or do I have the flu? So I just want to kind of share the differences here. For example, the cold, the onset of the cold, it's gradual, 2 to 3 days. The flu, if you're fine 1 minute and 2 hours later you're feeling cruddy, chances are with the sudden onset it could be the flu. With the cold, upper body, mostly the head. With the flu, it's the whole body. Fever with the cold, low, and sometimes you won't have any fever, but it can be very high with the flu. Headache, rare with cold. Usually it does happen with the flu. Aches and pains, mild with the cold. Obviously, we've probably all had the flu at one point.
Oh, yeah.
Usually there are aches and pains, and it's severe. Runny, stuffy nose, it's common in the cold, sometimes with the flu. Fatigue. Generally with the cold, it's very mild, if at all. And again, we all know with the flu, you feel very, very fatigued.
You feel like death warmed over.
Oh, definitely, definitely. Sore throat with the cold, it's common, sometimes with the flu. And finally, cough with the cold, it's usually mild or moderate. It can be common with the flu. And lots of times with the flu, it can be severe. So those are just some simple things that people can kind of hopefully differentiate and at least give them a sense of, gee, I wonder if I've got the flu or the cold. Obviously, the best thing to do is to consult your healthcare provider.
That's right.
And if you start growing fins, then you're in trouble.
Then you better go to the ER.
Yes.
One thing I would like to say about this is that if your doctor gives you antibiotics, make sure you take the entire complement of antibiotics, because bacteria, tend to adjust to those antibiotics, and you could actually become antibiotic resistant. So make sure you take the entire complement that your doctor gives you.
And our disclaimer, Michael is neither a doctor nor nurse either.
and since Michael had brought that up, I do want to mention that flu is a virus. So for viruses, antibiotics aren't going to do anything for viruses. But Michael makes a good point that if you have a bacterial illness and your doctor gives you antibiotics, that you need to follow the regimen that he or she, your doctor, has produced. I wanted to also say that this flu season, we have 22 reported hospitalizations of flu, and flu is a reportable disease, which we track hospitalized cases, which you can imagine that you've got to be feeling pretty bad to be hospitalized, and pediatric deaths. And so for this season, El Paso County has had 22, and we feel that that's just the tip of the iceberg. There's so much more going on out there that people are ill, with the flu, and they're not making it to be hospitalized. But you can imagine it is a severe, it can be a severe illness, and it's not too late to get vaccinated and do all the prevention measures as far as washing your hands, covering your cough, all of those things, so we can stay healthy. And when you're sick, don't go to work, if that's possible.
Did you hear that, bosses?
Don't give it to me.
When did these hospitalizations, did you notice a time where it actually really started?
Well, and, we have all of that information on our website because we do track that. We have epidemiologists and communicable disease specialists that track that information, and that is on our website. And to answer your question, I don't know specifically the date, but it's usually, October, November, but, this year too, there's plenty of flu vaccine, and, people are, getting vaccinated, and, we're happy about that, because if you prevent one person from getting the flu, then you're preventing more and more. And Dan talked about population based. The more people you have protected, the community is going to be protected more as well.
That's right.
So, finally, in terms of flu, people can just call their healthcare provider. We've seen those signs outside of pharmacies, grocery stores, etc. So again, as Susan said, it's not too late to get the vaccine. And finally, I would like to say thanks again for the time you've given us to just barely scratch the surface as to what it is we do in public health here in our county. But again, we've given out the web page. Again, if people want additional information on the other programs and activities that we do have for our county, it's www.elpasocountyhealth.org, or they can call our main number, 719-578-3199.
And we hope to have you guys back on a regular basis, and certainly if anything pops up that the public needs to know about, give us we'll be in touch and we'll get you on right away.
Okay. I just looked up on our website, and I just wanted to answer Laurie's question specifically. On December 16th, we notified the public through the news media that we had 2 infants hospitalized with influenza. So this season, it was December 16th where we had our first hospitalizations, and it was 2 infants.
Oh, my. That doesn't make for a happy Christmas.
No.
Definitely. And usually it seems to kick in, or at least we've heard that February, January, in that area is when it really hits hard. Are we still expecting, do they say, the brunt of it to still be coming? Well,
and I'd actually, like to schedule another interview and have an epidemiologist or a medical director talk about the peak, of the flu season as well. We're still well into flu season, lots of activity. We still, encourage folks to get vaccinated, and folks can go to our website as well to find flu shots and the nasal spray in the community. So, I think that's something we would love to come back to address.
We will definitely do that. And thank you for hanging around. We hope we haven't made you late for a meeting or something.
Oh, no, it's lunchtime now.
Okay. Well, there you go.
For some people.
Dan's buying.
Yes, all right.
Again, Deputy Director of El Paso County Public Health, Dan Martindale, and Susan Whelan, Public Health Information Officer and longtime phone conversation pal, and nice to have you guys with us.
Thank you very much.
Thank you so much.
Thank you. And, of course, if you have any questions, keep those numbers and the website in mind. We'll also be able to pass those along to you and hopefully get them up on our website so you'll have that as well.
And remember your advice from the consumer advocate, don't eat rocks.
That's a good one. And we want to mention to our friend Andrea, yes, you do have the flu, it sounds like, from the symptoms. And my daughter, obviously on antibiotics, wasn't the flu, but if you do get it, don't share with Mom, okay? And speaking of health, we want to remind folks, and before we take a break, we're going to be out at the Health and Wellness Fair that's going on this coming Saturday out at the Antlers Hotel, and we're so excited about this. They will have screenings in the Stratton Room, bone density screening, PenRad imaging will be there, heart rate variability, the Health Express screening, Natural Health Improvement Center will be there. They're going to be doing blood pressure, body mass index screenings, visiting Nurse Association among some of the organizations that'll be there. And if you have chronic pain and fibromyalgia, they will have testing for that as well, thanks to the neurologic relief centers. So we've got from A to Z all kinds of health professionals. The YMCA of the Pikes Peak region is going to be there. We Care Pediatrics, Veda Salon and Spa is going to be there. Hopefully with, I don't know, like massages or something for all of us.
Well, even better, I'll be there.
Ranch Foods Direct is going to be there. Pikes Peak Parents, Optimum Healthcare Center, as we talked about. Optimum Health Center, that's Optimum Healthcare, I should say. Our old friend Dr. Plott's going to be there, talking about chiropractic and help for those who have had to deal with chronic pain. And we'll have dentistry there. And Aaron Hill face painting. So bring the kids, bring the whole family, or if you're a kid at heart, get your face painted as well. This runs, of all the things that they could have put on this flyer.
It's Saturday.
It's 10 to 4, I believe, at the Antlers. Free parking, so you don't have to worry about that. We will validate all parking. You park in the garage underneath the Antlers. Come out. We have booths galore, and like we've pointed out, you can talk to just about any health, even remotely related industry. And come on out and take advantage of those free screenings. I know those are, especially in these hard times, they can be expensive, and why not find out more about your health and not have to pay a whole bunch of money?
A free frontal lobotomy for me, yeah.
I don't see lobotomist on here.
No.
That's the only one. But you and I are going to be out there from 10 to noon. We'll have a booth. We'll look for the banner, the Consumer Advocate banner. We'll be out there to say hello, get your input on the show. If you have any consumer complaints, we will be taking those on the spot and investigating those and have reports on those coming up on future shows.
Great.
All right. So be sure to mark that down. That's this Saturday, 10 to 4. At least mark out that much on your calendar. And if it's longer than that, we'll let you know. How's that?
All right. Great.
We're going to take just a short break. We've also got some news items coming up. We'll update you on upcoming shows. And, of course, we've got our Consumer Crusader, T.A. Arnold, coming in tomorrow. And we'll tell you what he's going to talk about. But first, a quick break here on the Consumer Advocate Show. Again, log on, consumeradvocateshow.com. Join in the chat. And also you can call us at 593-7241 or 593-7242. We'll be right back.
Sports Animal 1300.
We got a little bit of time left on the Consumer Advocate Show. If you have a question, comment, concern, you want us to investigate something, give us a call right now. We'd love to talk to you. 593-7241 or 593-7242. As always, you could list any comment, question, or concern on our website. In fact, you can go to contact us, send us an email, or on live chat at consumeradvocateshow.com. And TJ's checking back in. Could you list the symptoms here on chat? You're having trouble with, we're having trouble with the live feed. We'll check into that, TJ, very much.
Okay.
Thank you. We appreciate that. And Tim, our computer guy, might be listening. So, Tim, if you get a chance to check that out, hey, that'd be great, too. We will put up the symptoms. I'm not sure that we have time to type it in right here, but, TJ, I'm sure we can get that on our website for everybody to take a look at and go to that as a resource.
Good idea. Thanks.
And, again, don't forget the health fair. We're going to be out there. And guests upcoming, T.A. Arnold, our Consumer Crusader, will be here tomorrow. And he fully intended to talk about jobs and things like that last time, but something was happening in the news that took us in a whole different direction. So T.A. will be talking about, the job front and really overall I love this, how to think as an economist.
Yeah, I need help with that.
I think we all do, definitely.
I'm still trying to balance my checkbook.
Well, some of us are better at that than others. I do admit that. And we also want to pass along to you some things that are going on because we're happy to be partnered with peakradar.com. And Peak Radar is a great organization that under one umbrella has all the local music, local arts, local performances. You can go to peakradar.com and find out what's going on here in town, who's performing. For example, at the Black Sheep, which I don't frequent, but Silverstein is out there. They're from Canada, very popular band. They're stopping in the Springs for a one-night appearance. They're out there tonight at the Black Sheep. So if you want to check that out, Dave Armstrong and the Art of Collage. I myself love doing collage. That's at the Coburn Gallery tomorrow, in conjunction with his newest publication, an open reception featuring a gallery talk by Dave Armstrong and poetry readings by authors featured in his publication. The reception is free and open to the public, and that's going on at the art, talking about the art of collage. You can all check out all these things and get more information, by the way, at peakradar.com. And looks like Dave Armstrong's going to be at the Coburn for at least a couple nights, all the way through February 11th, in fact, his presentation, The Burden of the Beholder. They say beauty's in the eye of the beholder. Is that a burden? According to Dave, it is.
Only when I look in the mirror.
The Barber of Seville Sessions, the recorded barber going on at Sound Shop. That's January 27th. Canvas and Corkscrews opening night at just a fun location, it sounds like, January 27th, opening up. Sounds like a new nightclub, maybe. Hey, you can go to peakradar.com and find out more about that. And, of course, as we go through, especially as we get to Friday, we'll tell you what's coming up on the weekend, things you can plan to do to support our local artists, musicians, that kind of thing. And Tim Wacker, the guy that has helped us put up our website and things like that, also has a pledge, really, to support local bands. And you want to talk about what he's got going on?
Well, My Band Radio is, he's trying to, for bands that don't have a label, you can go to My Band Radio for $5. You can download your music and get it heard over the internet and, kind of get it out there. And I really think that Tim's got a great idea here. And it's not just local bands, but it's, across the country. And he's been really successful with it. So check out My Band Radio.
And you can do that right on the web. Live. He does a live podcast, in fact.
Right. And he's going to make a link from our website over to his. So after the show, you can listen into My Band Radio. Not
necessarily today, but we'll let you know.
Yeah, I'm not sure it's up yet.
As soon as you can start doing that.
He's working on it.
Also on Friday, of course, we'll have some folks in from the health fair that's happening on Saturday. We'll be talking about that. And speaking of health and insurance and that kind of thing, if you haven't had a chance to check this out, the Consumers Union, and it's an arm of the nonprofit publisher of Consumer Reports. And if you get a chance to log on, not only to Consumer Reports, but Consumer Union at action@consumer.org, you'll find out a lot of what they're doing, and they take more of an active role. I think that's the active arm of Consumer Reports, where they keep you apprised of watching over insurance companies. And you and I had a discussion on this about insurance companies and
don't you love them?
Regulations and how the new health law is affecting insurance companies and skyrocketing premiums. In fact, I pulled up a thing where they've focused on Colorado here. The insurance companies, they say, are watching closely what's happening in Congress this week, hoping they won't have to make some very big changes to improve our health coverage. What has really got them worried, according to Consumers Union, is the power you have right now in Colorado to help put a lid on their outrageous rate hikes.
They are pretty outrageous. They're usually around 30%, and I think that's a little much.
And they just keep going up, not by little increments either.
I've never heard of them going down, that's for sure.
Yeah. They say Colorado has the power to get skyrocketing premiums under control by making insurance companies publicly justify certain rate hikes and reject them if they don't have a good reason for it.
Well, it sounds like a good idea to reject them, but, you know, when the CEO is making $680 million a year plus benefits, you kind of got to think maybe they're a little overpriced.
Well, and that's the thing. Where do we start getting the power as the consumer? And this is maybe one way to do that. They're encouraging everybody to, of course, you know, email, write your congressman, your lawmakers to take action. I think that's what our goal is to encourage folks, make them aware of these grassroots efforts, and maybe even start up a few on our own here in Colorado Springs and El Paso County to start taking some of the power back.
Well, we are starting a citizens union with the Consumer Crusader, and we'd like for you to join the citizens union because we really need a legal defense fund, and we'd like to start holding some rallies and, you know, bringing up issues like this because, quite frankly, we're being taxed to death, and then the insurance comes along and hits you. It'd be nice to have a little money left over for you and your family, you know? And
a lot of folks have felt so long that they just didn't have a voice. They were powerless. And I think there's an uprising. And as Tom mentioned, you know, that's a bit of what's behind, or maybe a lot of what's behind the Tea Party.
Oh, yeah.
People just tired of what, you know, of accepting, quote, normal.
Well, you'll hear our motto here at the end of the show, and I think you'll understand. But if you'll join the Consumer Crusader, you too can be a crusader and even start your own grassroots movement.
And we want to let you know that our website is always updating and changing, and there are so many more things that are coming to our website for you to be a part of, for you to join in the Consumer Crusader movement. If you're one of those that feels like a lot of us are starting to feel with our motto, just not going to take it anymore, go ahead, hit it. We'll hit it more than once.
I'm as mad as hell, and I'm not going to take this anymore.
If you're feeling that way, join us. I mean, we're starting to give people a voice, and the more of us that come together, the bigger that voice gets. So keep an eye on the consumer, and it's consumeradvocateshow.com. That's our website. Keep an eye on there because we're adding new things all the time, ways for you to get involved, ways for you to solve problems, ways for you to actually have that consumer voice that maybe you didn't feel like you have had in the past couple years or even longer than that.
Yeah, if you can start your own grassroots movement and we can be of any help to you whatsoever, that's what our website's going to be about, and that's what our radio show is going to be about.
If you've got a group or organization that's already heading in that direction, let us know. We'll get you on the show. We'll let people know that you're taking action.
Got to do something.
That's right. Why, Wheels?
I'm as mad as hell, and I'm not going to take this anymore.
That's right.
All right.
Hey, have a great afternoon. Get fired up, and we'll be back here at 10 tomorrow morning on the Sports Animal, 1300 a.m. Hope you will be, too. We're the Consumer Advocate Show, Laurie White and Michael Satterfield, and we'll see you tomorrow.
Thank you for listening.